Good morning. Thanks for coming. Please welcome Gabriel to talk about managing dynamic study consent.
Yes, thank you, and good morning, and nice to see some people made their way into this session despite Graham's keynote. I'm going to talk about dynamic study consent and managing it with FHIR. Oops, I need to set the focus. I'm Gabriel Hess. I'm working as a project manager and developer at the Bern University of Applied Science. We're actually the first place in Switzerland where you can study medical informatics, and we also have the Institute for Medical Informatics, FHIR, where I'm working and developing mobile and web applications, working on Swiss EPR and of course on FHIR. So managing study consent, let's straight dive into the topic. For introduction, imagine Marie, a patient, 75 years old, has some conditions, for example, macular degeneration, and for this she needs treatment, and she visits the hospital of Jules Gonnet in Lausanne, where she meets Dr. Jean Dubois, the ophthalmologist, who is treating patients but also researching macular degeneration. And of course, during the treatment, during examination, there is data created, images are created, and Dr. Dubois would like to use this data and these images for his research, but he can't just do it, but he has to ask Marie for her consent. So usually she can sign a paper allowing the researcher to use the data in his research. All fine, but if you imagine at the later stage, Dr. Dubois or maybe another researcher at the hospital wants to do another research study in which this data could be useful, he either has to contact Marie again and ask her for her consent, or how it's usually done in the first place when she visits the hospital, she can sign a general consent, giving the hospital and the researcher consent for every oncoming study to use this data. Exactly, this is done by general consent, usually on paper these days. One problem with this is that it's a bit difficult to have an informed consent if the study is not yet defined at the time of the consent being signed. So it would be, of course, better to give the patients the possibility to decide on a per study base if they want to participate in this study after being informed about what it's all about. But of course, this is difficult because we have to recontact the patient or bring them back into the hospital and then explain everything. And it's also difficult to have done in paper form. So we had this project with the goal to develop a prototype for dynamically managing the consent for research study participation. We are the Bern University of Applied Science and also Mutata, which is a FHIR backend that we were using, and then health portal, and also the lead in the project was at the Hospital Jules Gonnet, which is the University Clinic for Ophthalmology in Lausanne in Switzerland. The whole project was funded by the Swiss Personalized Health Network, SPHN. So let's have a look at the prototype. The heart of the prototype is a web application that can be used by the patient that allows the patients to see information about the studies that they can participate in and to share their data, give consent, or also giving a general consent in a digital way. We also implemented that. But the prototype allows also to see the images and the data that was created during the treatment at the hospital, so the patient can see what they are sharing, and they also can access additional information about eye anatomy and pathology, so they can even make a better informed consent to the studies. Then we have the FHIR-based backend, which is Midata, it's a personal health record, and we are using this for storing and managing the consent information, and also to provide secure linking to the hospital system. The web application is, with one exception, not talking directly to the hospital system, but to the FHIR backend, and this is linked to the hospital system. And then, of course, the hospital system or hospital systems. There are multiple, but in our project is like a black box because it's just one access point. And there is stored, the actual imaging data is stored and managed on the hospital systems. So let's have a look at the data model. I hope you can read this. As the actual data is stored on the hospital system, we are using just metadata on the FHIR backend, stored in a diagnostic report, resources which are linked to the actual data, which is not stored in FHIR, but some proprietary format that's not relevant here, on the hospital systems, and we are using the identifier in the diagnostic report to link to the actual data, which is a 1-1 relation, one diagnostic report per dataset. We're also using media resources. There can be 0 or multiple per diagnostic report. We're just using this for displaying preview images in the web application. The actual image then is linked to the icon viewer that the patient can access. We're modeling the research studies, of course, as research study resources, which are accessed by an open FHIR endpoint directly from the hospital system, because there is no patient data included. We can do this for security reasons. We have here also just meta information about the study title, description, contact information, and we're using the identifier of the study in the hospital system and also the Swiss ethics identifier, which uniquely identifies every study. Then the heart of the project are consent resources, of course. We have every consent belongs to exactly one research study, and of course there can be multiple consents for every research study. And because we don't have a direct link option in the consent resource to research study, we were modeling this with a category where we use the ID in the hospital system as a category for the consent, so we can identify which research study that the consent belongs to. And then, because every transaction between the system is also signed, we had to use provenance resources, which we used for signing the consent after transaction, so we can acknowledge every transaction and see that everything went well. So, after the theoretical data model, let's have the example use case, just straightforward, the use case of the patient that uses the application, sees a new interesting study which he wants to share data with, and then gives consent, and then let's have a look at how this works. First, when the patient logs into the app connects to the open endpoint of the hospital system, fetches research study resources, which a bit stripped down looks like this. We have two identifiers. The important one is with the hospital system and the value of the ID of the study in the hospital system. We also have the contact information, the description, which is marked down so it can be easily displayed in the web application. Of course, title and status. And then the patient decides to give consent to share data with the study. The web application creates a consent resource which has in the category coding with the system of the hospital and the ID of the study, which links it, and this is then transferred to the FHIR backend, where it triggers a subscription on consent, which triggers a script that signs the consent resource as uploaded, with a link to of course, the consent resource with the actual version number of the resource, and the signature as base 64 string. Also, at the moment that the subscription is triggered, the consent is written into a list resource that we keep on the FHIR backend for every consent that is not signed. I will come to this later, but then after putting it on this list and signing it, we send the bundle with the provenance and the consent resource to the hospital system, which then also signs the consent resource, not the whole bundle, just the consent, and with a similar provenance replies to the script that did the transaction. And if everything is okay, the consent matches the signature, we can just take the consent off this list again and give the web application feedback that everything went okay. If the signature doesn't match or no response is given, the consent stays on the list, and we process this list several times an hour and try to send information again. And if it fails for a given amount of times, admin is notified. Yeah, so let's come to the challenge we faced, and for some we anticipated, some we didn't. How can we assure that the systems are in sync? I think with the signing of the consents we didn't have to do for legal reasons in one hand, and also can use for like an acknowledgement that the consent was transmitted, and the system with this list where we keep track of unsigned consents. We can on one hand assure that every consent gets signed by the other system, and we can also assure that the systems are in sync. One challenge we didn't anticipate, but I think was quite interesting. In the beginning, we just signed the whole consent resource, certified it and signed it, then uploaded it to the other system, but then found out, oh no, the signatures don't match. Because, for example, if we have a temporary ID in the bundle for the consent resource, they send it to a FHIR server, the FHIR server gives it a permanent ID, it responds, but of course then the consent resource is not the same anymore and the signature doesn't match. Or it could also be that in JSON representation that the fields are sorted in a different way, and then of course it's also not matching. So we had to define like a way how exactly the resource has to look before we sign it. Yeah, I think it's also getting close to the end of the session, so what are the next steps? We're just before rolling out to test users, then we also have ideas in mind for second version, and of course we have to evaluate the whole thing. But first, yeah, if you have questions, you can ask them in Q&A later, or you can contact me during DevDays. I'm here until tomorrow evening. You can write me an email. I'm not on Twitter, but you can connect with me on Mastodon. And of course you can give feedback to the session, but I'm not sure if I actually get to see this or it's just for the team. So if you want an answer, you better contact me directly. Yeah. So are there any questions?
Thanks, yeah, that was very interesting.
Thanks. I have lots of questions, actually, but they're not. They're kind of about the context of the system more than the technical details. And one of them is whether the ethics board or the institutional review board, I'm not sure in Switzerland who's responsible for sort of that kind of approval. But did they view this as something that they really embraced and were eager to see because it solves a problem, or did they view it as something that they didn't want to hear about? But I'm curious, like, you know what I'm asking?
Yeah. I have a bit of difficulties to answer this because the lead for the whole research project is at the hospital Schilgone, and we were just the technical partner for this. So I was not directly in contact with the ethical board and this. So, but I hope they see it as something worth having a look at.
And this it's not an area that I know a lot about, but my second question is, there's a group in the States, in Seattle, who have worked on electronic consent a lot, and one of the things that I remember hearing about was is there an overall framework for electronic signatures in Switzerland that this sort of fits under that makes it okay, or is this sort of a new area also? In the U.S. it would be a new area, basically.
Yeah, also it's, there were like several attempts to have like electronic signature at a state level, but it's not, we're not really quite there.
Yeah. And then the third question I had, the last question I have, is about patients.
Yeah.
You've done this small pilot so far with patients?
No, not yet.
Just as a demonstration? Okay, yeah. I was curious because it seems to me like this is the kind of thing that some patients might understand and really appreciate, and other patients would sort of say, why do I have to install an app on my phone? Why does this matter? Like, I'm done with my study. I don't want to hear about this again. But as a researcher, we know, how important it is to have recurring contact and be able to reuse patients' materials for other studies. So I'm curious, do you know if the team that will be trying to study this, have they thought about like how to frame it, how to talk to patients about it, how to talk to patients about the value of this extra bit of work for the patient?
Yeah, I think we try to give them additional value, like they can access their information also, and
Right.
they are able to give more detailed consent if they want, so they just haven't, I think they still can do the general consent and then forget about it. But if they want, they can give more detailed consent, and they also, I think, which also can be an added value, that they can actually access their images, like, because it's not given everywhere in Switzerland now. Yeah. And also the point with installing an app, it's because it's the reason we didn't do an actual mobile application, but a web application you can just open in your browser, so you don't have to install anything. Because we also thought, it's probably no one is going to install something for this.
Maybe not a question, but a thought. Could it be that patients will also think that's cool, that's interesting? I can see this specific study is being done, and I'm being a part of it. I mean, I can imagine that would be.
Yeah, I personally also would think it's really cool to see which studies that actually are done with your data.
Yeah, thank you for your talk. I have a question. You just mentioned that in the end. So you were working on that the consent resources that you signated them. So they were not able to get changed afterwards, I suppose, and that consent resource matches the signature which the patient gave. Right?
No, it's not the patient who signs it, but it's like the application is like viewed as trusted by the patient, and also the without the FHIR backend signs it on one hand, and the hospital signs that it received the consent as we sent them. So just we can prove. Yes, this is exactly the consent we sent you at this time, with the patient giving consent or denying consent for this study, and you acknowledged that we sent this.
Okay, and so how do you ensure that the web application is the trusted is trusted, and that the patient is the patient who signs the consent for himself?
Yes. Of course, the application connects to the FHIR backend with OAuth, and we have actually a linking mechanism that is when the patient is onboarded, that he is known in the hospital system as the patient who he is, and then the hospital system sends a token to or a registering link to the smartphone where the patient sets up his he can register on the FHIR backend or use an already existing account he has, and then link it with the token that he got from the hospital system just by clicking the link, of course, and so we can assure the patient matches. But the linking is done on the hospital system, so the FHIR backend doesn't know the IDs of the patients on the hospital system, but the hospital system knows the ID of the patient on the FHIR backend. And, yeah.
Thanks. That's all the time we have, but that was very interesting.